Cedrone. Vaccinations are essential for a healthy community. Measles, diphtheria, mumps, rubella, polio, tetanus, pertussis, varicella. Diseases such as these struck hundreds of thousands of infants, children, and adults in the United States. Thousands died. As vaccines were developed, it became widely used. Vaccines declined, the rates declined of these diseases. Although many of these illnesses and diseases are not often seen by many of you, they still exist, and we have periodic outbreaks. Even scarier than that, many of these actual diseases occur throughout the world and cause many deaths in the world. I've been a registered nurse for over 30 years, and I've actually taken care of some people with these actual illnesses and diseases. And I've worked as a school nurse for over 13 years, and part of my role is to ensure that all children are vaccinated upon entrance to school. In addition to that, I have to ensure if any of those children cannot be vaccinated because of a medical condition, to ensure their safety, their health, and that they will not get any of these diseases and illnesses. I believe I understand the problem, its causes, and how we can end devastating diseases and illnesses. Many of these devastating diseases are preventable and can be stopped by vaccinations. Today we will examine what some of these vaccine preventable diseases are, the side effects, and how it affects our community. Vaccinations prevent illnesses and diseases. Now let's review some of those diseases that are preventable with vaccines. Measles or rubella is contagious viral infection. In 1920, there were over 400,000 cases with over 7,000 deaths in our country. Vaccine was licensed in 1963. In 1999 to 2001, there were only 15 cases in the United States. 90% of the school children by then were receiving 2 vaccines, the MMR, which is the measles, mumps, and rubella, twice, 2 vaccines. The public health officials declared measles no longer an endemic in the United States. However, in 2000, reported cases of measles began to rise. And in 2011, most cases were linked to traveling. In 2014, over 600 measles cases were reported in the United States. In January of 2015, there was an outbreak in Disneyland in California where there were at least over 50 cases reported. The ages of the people that were contacted the measles were ages 10 months old to 57 years old. The public health officials estimate in countries around the world there are 20 million cases of measles each year. Mumps is a viral infection that affects the salivary glands. Before vaccination, over 180,000 people were reported to have it in the United States. In 1948, the vaccine was introduced. Current vaccine provides over 80% long-term immunity. In March of since pre-vaccine era, there's been a 99% decrease in mumps in the United States. However, in March of 2016, there were 8 cases of mumps detected in Sacred Heart University in Fairfield, Connecticut. Rubella, or the German measles, is caused by a virus. It infects. It's usually it's mild with a fever. However, if you're a pregnant woman, if a pregnant woman gets infected, the virus can cause serious birth defects. An epidemic in 1964 to 65 infected 12.5 million Americans, killing over 2,000 babies and causing 11,000 miscarriages. In 1969, the vaccine was introduced. In 2012, only 9 cases of rubella were reported to the CDC. Diphtheria is a contagious bacterial disease. It spreads with coughing and sneezing. It causes breathing and swallowing difficulties. In 1921, over 2,000 cases of diphtheria resulted in over 15,000 deaths. In 1920, the vaccine was introduced. Since 2004, only 1 case of diphtheria has been documented in the United States. But according to the World Health Organization, In 2014, over 7,000 cases of diphtheria have been reported worldwide, and still many are unreported. Pertussis, or whooping cough, it starts off like a simple symptoms with a cold symptoms and a cough, and usually a person has a cough that at the end of it is a whoop. Many babies, though, have actually a symptom called apnea, where there's a pause in their breathing, and at least half of babies under the age of 1 year old are hospitalized. Coughing fits can last up to 10 weeks or more, and it's a major cause of illness and death in children in the United States. In 1945, over 1 million cases were reported. In 1940s, the vaccine was introduced. A number of cases began to decline from like over 200,000 per year to as low in 1976 of a little over 1,000 cases. Since the 1980s, however, there's been a reported increase in whooping cough. According to the World Health Organization in 2008, 16 million cases were reported worldwide. 95% were developing countries, and 195,000 children died.